Hi everybody, welcome to Beauty Buzz with Lori. So today is our last segment in my month, my birthday month, and we're going to be talking about another one of my favorite self-care things, which is going to be injectables. So my favorite things for injectables is going to be the cheeks, getting those filled up because that adds some youthfulness back to the face. And then also getting Botox done. So today we're really going to focus on Botox. So Becky, how often, if someone's looking to start doing Botox for the first time, should they expect to need to come in and keep up with this procedure?
So that's a great question. And Botox, you're going to get the best results from your treatments if you treat regularly.
So what does regularly look like?
So basically before you get full movement back, which for most people is somewhere around 4 months.
Okay, perfect. So that's what I usually tell people too, is around that 3 to 4 month mark. It can be a little bit different for everybody, right?
Absolutely, yes. Like any medication, it's going to work a little bit differently for everyone. But the key is regular treatments and before you get full movement back. Because once you have that full movement, you're creating the lines that we are trying to lessen.
Okay, perfect. So, and that is, whenever you come in, part of our process is you're going to be getting photos prior to having your Botox injections, and so you're going to be asked to smile, frown, and have no expression whatsoever, raise your eyebrows, all these things, and that's so that we can judge whether you need a touch-up at your 2-week follow-up, right?
Exactly, yes.
Okay, perfect. So we do take after photos as well. You have the opportunity to come back in if you've still got a little more movement than you're looking to have, that you can have that touched up with Becky. So we'll go ahead and I guess get started.
Okay.
All right, this is super easy, you guys.
Okay, so the first thing I'm going to do is clean your skin with some alcohol.
And we've already done, again, photos as well as I've already done my consent.
And the consent is important. That's where we talk about the benefits and risks of the injections. And then I'm going to go ahead and mark her. I like to take my time with marking, and then when I do the injections, I like to keep that moving pretty quickly just to get it over with. So turn towards me and raise your eyebrows. And frown. And smile.
So just so, because I'm actually curious about this too, when you're doing the marking and you're asking me to do all of those facial expressions, that's helping you with placement of the Botox, so you can see, where you want to lessen that movement and prevent those hard lines?
Exactly, yes.
Okay.
I'm looking at everyone's muscles are going to be a little bit different. Some people have muscles that are a little stronger on one side or the other.
Okay.
Yeah.
Oh,
so
that's interesting. I didn't know that.
Yeah.
So it's normal to have a little bit of redness at the injection site. This actually goes away, I find, fairly quickly. Anytime you inject on the skin, there's always a risk of bruising. Those are some of the things that she covers in the beginning. I personally have never had any bruising from the Botox, which is interesting because I bruise very easily typically. So it's always nice when you don't get a bruise.
Yep, and there's really not much post-treatment care. I always recommend to avoid strenuous activity and avoid, rubbing any of the areas that we injected.
For how long do you have to avoid that, maybe?
Just for the day.
Okay.
Just for the day of the injections. There used to be a lot more post-treatment instructions, but more recent studies have found that they're not necessary. So it's really pretty easy. The full result takes up to 2 weeks to see, but people usually notice some changes in the first couple of days after their injections.
Yeah, I've talked to people, and some people see within a couple of days, and others it does take like almost the full 2 weeks in order to see their results, and that's just with your lack of movement that you have available, your range of motion, I guess.
So we're going to sit you up. I'll hand you a mirror. You can see you've got some little bumps where you were injected. Those
Yep.
should go away within an hour or so.
Perfect. All right, so you look like you got some little bee stings at first. But like I said, mine usually is gone like in an hour. Mine won't even be present, maybe even that 30-minute mark. So just leave it alone. Don't stand in front of the mirror or focus on it. It's temporary, it's gonna go away. So if you're looking to have Botox done for the first time, Becky's your girl. Thanks for watching.